improve outcomes, quality? How can I make people feel better about the experience, so patient satisfaction? When I was in the hospital business, we did everything we could to reduce our cost. From 1988 to 1997, healthcare inflation dropped from 16% to almost a little bit less than 1%. We had 95 open heart programs, and we measured everybody every month to make sure that we had the lowest mortality in every city that we were. We tried to make sure we had the lowest mortality in every city that we were in. And Congressman Burgess is right. We had an electronic medical record 15 years ago. Everybody, we had 343 hospitals, 135 surgery centers, 700 home health care agencies, and we're all on one system that people could access, the doctors could access from their house. Since I left in '97, the other healthcare things I've been involved in, I did purchase the first healthcare cable channel. Eventually that became part of Discovery Health. 3 years ago I set up a company called Allerjure.com to try to create a free connector between providers and patients on the internet. We recently sold that to Health Grades. And then I'm chairman and founder of Solante Corporation. We have 24 walk-in urgent care centers. What these are is they're about typically 3,500 square feet. You walk in, somebody greets you. It's a nice waiting room. All the prices are up on the menu board. So if you're going to see a board-certified family practitioner, it's $89 to see the physician. If you have every service we do, the maximum price is $229. We only have 3 prices for seeing physicians. It's $89, $149, or $229. So if you get a suture, x-ray, everything is $229. We've done studies with insurance. The same fee would be $519 more for the average patient if you went to the ER, and it would be over $1,000 more if you were paying out of pocket. So in the city of Jacksonville, there's 1 million people. The most conservative number we could put out, we did a study, was that every year you could save, the consumers would save, and whoever writes the check would save over $120 million a year if they used our facility instead of an ER. And approximately 70 to 80% of the people that walk into an emergency room can come to us instead of that. And we're faster. Of course, we think we're better. So that's what we do in that regard. We also do, at that company, we do physicals, we do all the shots, all the immunizations, we do a lot of flu shots. But again, everything is, there's a price up on the menu board for everything you get. You cannot get past the registrar unless it's life or death without knowing exactly what you're going to pay. If you're using your insurance, you know exactly what your copayment or what your deductible is. So we have 24 locations now. 3 of them are in Walmart supercenters, 2 in suburban centers, and 1 in a rural area. All of our locations have been successful. We're in poor areas and we're in nicer areas. And we run about 50 to 150 patients a day in each of our locations. So it's worked out very well. We'll have between 30 and 35 locations by the end of the year. We have recently entered into joint ventures with hospitals. We've done 2 joint ventures. We're going to announce a 3rd with Shands Teaching Hospital in Gainesville next week. So in that regard, they generally will own half the centers, and then we'll try to work together to make sure the patients head towards the, it's better for them to go to the emergency room. We direct them there, and if it's better for them to come to us, they come towards us. Recently, I organized Service for Patients' Rights. We launched our website and our advertising campaign March 2nd. The whole key was come up with 4 pillars for meaningful, positive healthcare reform. First was choice. You should have the right to choose your own doctor. You should have the right to choose the health plan that fits your needs and your budget. Second, competition. We need to give consumers the opportunity to shop for healthcare. So providers, insurance companies post prices, post outcomes, post everything they can to be helpful for a consumer to make a decision online so people can shop and compare for healthcare. Third, accountability. You should have the same tax break as an individual that employers do. Supposedly almost half the uninsured in this country are uninsured only for a short period of time between jobs. If you owned your own health plan, then you wouldn't have that same issue. Also under accountability, we should have standardized. One thing the government can do well was get a standardized medical record to make it easier to pay for consumers to file their claims. And our 4th is personal responsibility. We cannot control healthcare costs unless we reward people for taking care of themselves. We recently put out, it's in the back of the room, we put out a survey that we just did Americans are very supportive of our four pillars. Almost 97% of Americans want to have the right to choose their own doctor. They want to have the right to choose their own plan. 92% want to choose their own plan. 9 of 10 believe that providers ought to post prices and results. 9 of 10 believe they should get the same tax breaks as employers. Almost the same percent, 87% believe there ought to be standardized medical records, and 83% believe we ought to reward people for taking care of themselves. So our goal with the Service for Patients' Rights has been, these are our four pillars. We will support whoever's plan fits those four pillars. What we've done so far is we ran ads in DC for 3 weeks and on the radio for 3 weeks, talking about our four pillars. And then we did 3 weeks of advertisements saying, look, we all want meaningful healthcare reform, but let's don't allocate the dollars before we know what the plan is. We are coming out with a documentary on the impact that the Canadian and the UK healthcare systems have on individuals. We'll be doing that in May. The whole goal is let's have good, meaningful healthcare reform that really takes care of patients and focuses on those four pillars. So thank you very much.